focused on the community. What happens at hospital is really important too.
It's got your augmentin, IV, yeah.
All health intervention needs to be timely, and the board continue to make changes at the hospital end to deal with demands for both acute and elective surgery.
In recent years we've made enormous progress with elective surgery, and a lot of that is to do with the opening of the Manukau Surgery Centre at Browns Road, which is a purely elective hospital. So in other words, people who have sudden serious illnesses or car crashes or some other sort of surgical emergency are not treated there, they're treated at the Middlemore site. So those patients are not influencing the ability of elective patients to get into theatre.
You mustn't forget, we're probably one of the largest acute DHBs in the country. We have the busiest emergency department in Australasia. So we have, in a sense, some tensions which we have to work really hard to get the best bang for our buck in terms of delivering both the acute care that people need, but also using primary care to support people so that they don't fall into needing the acute care.
What we've seen is therefore an increase in the volume of elective surgery we can offer, and in some respects also the scope of surgery. For instance, the orthopaedic department have very little, if any, waiting lists now for joint replacements for hips and knees, which is a staggering achievement, and one that I think if you'd asked us as doctors a few years ago would we achieve by 2006, we would have said don't be stupid.
Lesser surgical procedures are now being carried out at clinics and general practices. With additional resources in the primary health area, the 8 PHOs are able to access a wider range of networked services.
Well done, keep going. Oh, very good, Parikura, kia ora.
It's really about trying to shift resources into the community and get better care happening for our population.
You will find over the next 5 years GPs will be doing more and more in their surgeries which are upskilled towards the secondary care or hospital end. You'll find GPs doing small operations in their surgeries. You'll find nurses doing higher levels of care.
I think the biggest issue facing the sector is sustainability, and when you look at the epidemic of obesity, which is leading to a lot more disease in terms of diabetes, renal disease, cardiovascular disease and premature death, and when you look at population growth, when you look at ageing of the population, when you look at ageing of the workforce, we know that today's model is not going to cut it.
Shifting care to the community is helping our older people live full and happy lives in their own homes. One of our PHOs, East Health Trust, is running the Elder Care program.
Oh, hi, Mr. Telford, how are you?
Elder Care is an East Health PHO program that was set up about 6 years ago to help provide a more coordinated service for older people living in this area. We realised that there were lots of services available and there were lots of older people in this area, but often they were falling through the gaps.
We've got a degree of responsiveness to our community needs, so we're actually out there looking for what's needed, looking for what people need for care.
5 years ago, GPs were interested in the individuals coming through their door. Now they've got a responsibility for the population that's on their register.